Hello, everyone. So, today I'm going to discuss emergency contraception in the OBS and Gynae series. This is the second video. The last video was about regular contraception. So, before going into specific details of how to do history taking and examination and management in these cases, let me just tell you that there are basically three main forms of emergency contraception in the UK. Okay, number one is the copper coil or copper IUCD. Number second is levonorgestrel, and it is also named as Plan B, which is basically its market name. And then there is aliperstrel, and this is also known as Ella1. Okay, now copper coil or copper IUCD can be used for up to 5 days after an episode of unprotected sexual intercourse, and similar timings are for Ella1. So both Ella1 and copper coil can be used for up to 5 days. Levonorgestrel, which is also known as Plan B, can be used up to 72 hours, so basically 3 days. Now, out of these three, copper coil, levonorgestrel, and aliperstrel, copper coil is the most effective one. So it is 99% effective in preventing conception after an episode of unprotected sexual intercourse. So copper coil is basically the most effective, and the only timings where it will be contraindicated will be any active pelvic inflammatory disease, any infection going on, any undiagnosed bleeding going on, and any abnormalities, anatomical abnormalities of the uterus. Okay, both levonorgestrel and Ella1, they have almost the same efficacy, which is around 85%. So the take-home message is copper coil is the most effective, basically. Okay. Another thing that I want you to know is the Ella1 is basically contraindicated in severe asthma, and it's also you cannot give it to breastfeeding mothers. If you are going to give it to breastfeeding mothers, then you need to tell them that as this drug is secreted in milk and it's not safe for the baby, so avoid breastfeeding for 7 days and discard the express breast milk. Okay, so these are the points that are actually important because you need to look out for these points in the history taking. So for example, you cannot forget about taking history of asthma, knowing whether the patient is breastfeeding or not. And you must also ask about any sexually transmitted infection, any abnormalities of the womb, any undiagnosed bleeding that is going on. Okay. Another thing with Ella1 is you cannot start the patient immediately on hormonal contraceptives afterwards. Okay. So, for example, if a patient presents to you with for emergency contraception and she's not been using any method of contraception previously, and you want to start the patient on COCPs, for example, or you want to start them on any injection or implants or whatever. So with coils and levonorgestrel, you can do it straight away. Okay, you can start them basically with coil. It won't be even needed, like the hormonal contraception won't be even needed because copper coil in itself can provide long-term contraception. For levonorgestrel, you can start them right away, but for Ella1, you need to wait for 5 days before you can start the patient on any hormonal contraceptive. So this was another point that I thought is important to keep in mind. Okay. Now let's talk about how are you going to manage such a case, how are you going to take history, and how are you going to provide management here. Okay, so for example, a patient presents to you for emergency contraception. She might start with, doctor, I'm here for the morning after pill, or there was a bit of an accident. So you need to ask an open-ended question. Okay, so you need to ask her, like in every other case, we begin with an open-ended question. So we'll ask her, can you please tell me a bit more about what happened, if you don't mind? So when you ask this question, the patient might tell you all the details by herself, like the date and the time, etc. But if she doesn't, then you need to ascertain when was that event. Okay, specifically the date and the time as well, because the cutoff timings are really, they are really specific. So after 72 hours, you cannot give levonorgestrel. Like if you give levonorgestrel, it won't be effective. So you need to ascertain the date and the time as well of the unprotected sexual intercourse. And then you need to ask about the last menstrual period. So when was your last menstrual period? And has this happened only one time since your last menstrual period? Okay. So this is because you want to ascertain that there was no unprotected sexual intercourse before before the one that the patient is presented for the morning after pill. So just want to certain that this happened only this time and not previously uh, in this menstrual cycle, okay? Because if there was another episode, for example, like 10 days ago, and her menstrual cycle was like the last menstrual period was 14 days ago, then there is a chance that the patient might already be pregnant, okay? So you need to basically make sure that this hasn't happened previously as well, okay, in the same menstrual cycle. So you will ask about her LMP and has this happened only once since your last menstrual period. Then you will ask about previous contraception. Was she practicing any form of contraception at all? Has she used any form of contraception previously? And then an important thing here is safeguarding screening. Okay, so the NHS recommends to do a quick safeguarding screening in all these cases, because if this was a case of abuse, okay, the patient might not voluntarily tell you. So you need to ask these safeguarding questions in a sensitive manner, okay? So you'll ask, are you in a relationship? Do you feel safe and supported in the relationship? And was this consensual? Okay. These are just quick safeguarding screening. These are, and you need to ask them in every case of emergency contraception. Okay. Just keep in mind that they are basically similar to the safeguarding screening in peds. So for every pediatric patient that is presenting to us, we always ask the safeguarding screening questions in the history, no matter what the complaint is. We always ask, okay, so who is at home, who takes care of the baby, how is everything at home? So we just want to make sure that the environment is safe for the baby. Um, Similar safeguarding screening you need to do in emergency contraception as well, okay? All right. Then we'll ask about the past medical history. So have you been diagnosed with any medical condition at all, any high blood pressure, any diabetes, any asthma? Because if the patient has severe asthma, then you cannot prescribe basically L1. If the patient says, yes, doctor, I have asthma, then you need to ask, okay, so is it controlled? What do you use for asthma? Have you been hospitalized recently for the purpose of your asthma? Because of your asthma, because you want to establish how severe the asthma actually is. If it is moderate to severe asthma, you cannot prescribe L1. And mild asthma, where the patient has on and off symptoms and she only uses salbutamol inhaler, then you can prescribe. Okay. You should also ask about any gynecological problem with the womb, with the ovaries. Have you ever been diagnosed with any sexually transmitted infection, any discharge from down below? Okay, any unusual bleeding from down below. Okay, so these are the questions that you need to ask, because if the answer to these questions is yes, it contraindicates the use of copper coil. Okay, then we will ask about medication. So are you on any medication at the moment, any allergies, and then the psychosocial questions. What do you do for a living, etc. Lifestyle questions like cigarette, alcohol, smoking. Um, you can ask if you have time, okay? All right, then we'll move on to ideas, concerns, and expectations. So ideas, you should ask what you already know about emergency contraception. She might have an idea. She might have used it before, okay? So what do you already know about emergency contraception? And do you have any particular worries about the process of emergency contraception? And any expectations? So was there any particular type of contraception that the patient felt would be more suitable for her? So these questions basically you need to modify them according to the case. So for example, if the patient doesn't already know anything about emergency contraception, then obviously you want to be asking the question that is there any particular type of emergency contraception that you feel is suitable for you, because she doesn't know anything about this. So you need to modify with these questions according to the patient response. Okay. All right. Then an examination. So both in regular and emergency contraception, the only examination that is helpful that we need is basically the blood pressure and the BMI. Okay, so we'll do the blood pressure and the BMI, and then the management will actually depends upon the history. Okay, so how much time has passed since the unprotected sexual intercourse. So if it is within 72 hours, we can give levonorgestrel. If it is more than 72 hours, then we will either give LM1 or copper coil depending upon the patient preference. So basically, it will depend upon the time and the patient preference. If patient wants to go with the copper coil, we will give the copper coil. If she wants to go with the pill, then we'll see how many hours have passed. If she's in the 72 hours window, we will give levonorgestrel. If it is more than 72 hours, we are going to give LM1. Okay. But it is important that you tell the patient that we have basically two options for you. One is the pill and the other is the copper coil. If you have previously heard about it, that we need to put inside your womb, and you need to convey this information to the patient that copper coil is the most effective one. Okay, it is most effective. It works 99% of the time. You need to convey this information to the patient because she doesn't know, and NICE recommends that copper coil should be considered in all women presenting with emergency contraception. Of course, if she tells you that no, doctor, I don't think it is for me, I don't want it, then you are going to give Ella1 or levonorgestrel. But you need to convey this information to her. Okay, so if we are going with the pill, for example, then you need to tell her that it is sometimes it cause some sickly feeling. You might feel like you might feel sick. But if you do vomit and it is within 3 hours of taking the pill, then please come back and we'll give you another one. Okay. So before this, make sure that you tell her that we are going to give you the pill and it is going to be a single dose only. But if you vomit within 3 hours, then please come back and we'll need to give you another one. Okay. Also, you need to tell her that the pill that we are giving you cause a disruption in your period, which means that your next period can be a bit heavier, or it can be a bit lighter, or it may be delayed. Okay. In case if the period is delayed, then please take a pregnancy test so that we know early on if the method has not worked. Okay, because if she takes emergency contraception and it doesn't work, it is paramount for you and for her to know as early as possible that she is pregnant, because then she might want to think about the termination of pregnancy. And okay, then STI screening is really important because this is an episode on protected sexual intercourse. You need to inform her about STI screening, that is important. You can tell her if this is in GP setting. Of course, this is going to be in GP setting because these type of patients present to the GP and not to the emergency department. So we'll tell her that we can do the STI screening here for you, or you can go to the the genitourinary medicine clinic, and they're going to take a swab and check it for different sexually transmitted infections. So that was all about emergency contraception. That was pretty much all about contraception. Basically, we discussed regular contraception and emergency contraception as well. The next video I will probably discuss contraception in minors, because in conception minors, you have a lot of ethical dilemmas and you need to know about whether to give contraception, whether to inform social services. So in the next video, we are going to talk about contraception in minors. So that was all from my side, and I will see you soon in the next video.